Hi, everyone. Welcome to Concussions and Women podcast, a series hosted under the Concussion Talk podcast by founder Nick Mercer. My name is Dr. Allyssa Memmini, and it is my honor to host this critical series highlighting differences in injury management and support for women who sustain concussions. Today, I am joined by Claire Coates, a certified athletic trainer, educator, TEDx speaker, and entrepreneur. With extensive experience caring for student athletes across youth, high school, collegiate, Olympic, and professional levels, her work focuses on injury prevention, injury management, rehabilitation, and helping athletes safely return to sport, academics, and daily life. Through her company, Mrs. Clutch Virtual Assistants, she serves as a strategic operations partner to CEOs and healthcare leaders, helping them reclaim executive capacity and focus on the work that only they can do. Claire, welcome to the Concussions and Women podcast.
Thank you so much for having me. I appreciate it, Alyssa. Good to see you.
Always good to see you. Before we dive into your clinical practice, can you please tell us a little bit about your backstory? How did you become interested in athletic training, and what do you love the most about your job?
Certainly. I discovered athletic training probably somewhere right at the correct time, right before applying to college. And I was watching Discovery Health a lot at the time, and I appreciated the fast aspect of medicine and helping people. But I was also a cheerleader at the time as well. So it was kind of introduced to me, and it put all of my worlds together. But what originally sparked my interest was watching my dad sustain an injury when I was really young. Growing up in southeastern Michigan, we used to drive down to Virginia to visit extended family for Thanksgiving. And one time we were down there and we had to stop at the post office before we went to Williamsburg for some tri-cornered hat, history lesson for the weekend or something like that. And he tripped, fell down, landed on his knee at the perfect point of flexion and shattered his patella into 15 pieces, and the shards of bone ripped through his ACL. And I remember
Wow.
someone retrieving my grandfather and my brother and I from the car because we were sitting in the parking lot just waiting for him to drop off something at the mailbox and pulled up his pant leg and I could see the trauma. And I still remember what it looks like today. And from there, it was like I thought later on, fast forward, I was interested in PT because, of course, it, was where medicine kind of collided. And then I said, well, I don't necessarily want to see people after the fact. I want to see when the injury happens. And then I discovered
Sure.
athletic training and pursued my education at the University of Michigan, loved all of my clinical rotations, started first semester working with football, and we were number one and number two with Ohio State, and had that battle ingrained in my understanding of what sports rivalry really is. And when you put the passion of getting everybody back to be in tip-top shape at the right time, and watching them kind of experience the adversity that they go through to get there, and the lessons learned that they can then take with them after their collegiate education is incredible.
Yeah, absolutely. Can you tell us just a little bit more about your current position with athletics?
Certainly. So I'm a senior associate athletic trainer, embedded in student athlete health and welfare in the athletic department, working primarily with field hockey and cheerleading, but all of us kind of on the Olympic sides of sports help each other out. Day to day, it doesn't look the same every day. We usually do student athlete one-on-one care in the morning, handle some administrative duties, documentation, and then usually in the afternoon, at least with my schedule in the fall, it's in the afternoon. Then we report to practice, and we're providing care on the sideline at
Mhm.
practice, or handling long-term rehabs before and after practice. We travel with the team and provide care on the road, and
Mhm.
so it's great because you're not only a part of the team, you're there to help the team. I know when they've had a bad day, I know when they had a good day, I know when exams are heavy, I
Yeah.
know when there's a holiday coming up and they're excited to get out of Dodge, I know when they're excited for the biggest game of the year, and that's the only thing on their mind. And so it's interesting how speaking, thinking about today's talk, if and when a concussion happens, at which point in the season, definitely the stress levels impact regardless because of the injury, but it ebbs and flows depending on the time of year as well. So,
Yeah, certainly. Well, thank you so much for sharing.
sure.
Moving into my next kind of set of questions, as you alluded to, we're going to be talking a lot about concussions in women specifically. And, I'm curious throughout the trajectory of your initial education and then now as a senior associate athletic trainer, Have you noticed any differences in concussion education, recognition, or recovery tools, and how that has maybe most supported our female student athlete populations?
Absolutely. So I think back to when I started, 20 blah, 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 and it was let it sit for 15 minutes and we'll check on you later.
Mhm.
Now clearly not the case. Now even that we're asking questions such as this and having these really healthy conversations around where are the differences, how do we address them?
Mhm.
I think the biggest thing that I've seen is the importance of looking at the entire student athlete or the entire patient, and
Right.
especially thinking about females outside of sport, or even professional level athletes. Like it's not just how it impacts their sport, it impacts how they perform as a mom, it impacts whether or not they're nursing, it impacts whether or not they can stay up late that night to handle what they usually handle after their 9 to 5 or whatever. So yeah, definitely differences in reporting frequency and
Mm.
threshold on the student athlete side. Um, and I have found more of their teammates are holding them accountable when they recognize maybe signs and symptoms
Wow.
in the locker room or things that I wouldn't see. And that's even outside of concussion. Like, hey, just so you know, so and so doesn't want to mention it, but I wanted to be sure that you were aware of XYZ. Oh, thanks so much. So they look
Yeah.
out for each other, but then they also look out for each other in terms of making sure their health and welfare issues or needs are reported to the appropriate people.
Yeah, absolutely. That's a great point. Um, what do you believe are the unique challenges our female athletes may experience, maybe more than our male athletes during their concussion recoveries?
Um, One challenge is the interaction or intersection between concussion symptoms and hormonal fluctuations.
Mm-hmm.
Change throughout the menstrual cycle can influence back pain, headaches, fatigue, mood
Right.
changes, sleep consistency, obviously cognitive function, and it makes it difficult to distinguish chicken or the egg a little bit.
Hmm.
There's also some female student athletes who are dealing with cycle irregularity anyway. Sometimes
Hmm.
that's stressful event or inconsistent eating. Then we're looking at the female athlete triad, or they don't call it anymore. It's Red S now.
Hmm.
Layered on top of a concussion is that part of the body stress response as well.
Hmm.
So again, it makes it difficult to distinguish what is concussion related versus what may be influenced by hormonal factors.
Yeah, similar to this topic, I'm just curious, based on your professional development opportunities or going to conferences, how have you been educated in this space, particularly regarding the differences in concussions between male and female student athlete groups?
I'd say opportunities are definitely emerging. And
Hmm.
speaking with you, stuff like this, I hope it brings it to the surface that more folks would seek out opportunities to learn the differences and also provide the information to the athletic training community to be more, well versed in understanding it.
Hmm.
Um, but it's just important to recognize that they're going to tend, female student athletes are tending to report more often than their male counterparts. And I say that
Hmm.
having worked with field hockey and a women's sport for over 10 years, I did spend a significant amount of time working with men's soccer and high school football prior to. So you definitely
Hmm.
see it, and it's there. And I would think from a continuing education standpoint, I would hope that more of those opportunities are brought to the surface for people to investigate. Um,
Hmm.
Me, personally, it's I don't want to say anecdotal findings, but being in the trenches with my, laces strapped all the time, standing in the rain with them, and navigating the academic and personal and athletic nuances that go with a safe return to play happen every
Hmm.
day.
Yeah, absolutely. And what you're reporting is just like what we see in the concussion literature. Females are much, much more likely to report their injuries, especially concussion, and then be more honest about the symptoms that they're experiencing. I don't necessarily believe it's a biological response. It's probably more social component to it too, but I do think that the influence of the menstrual cycle could have that biological component, certainly.
Mhm. Mhm.
Um, how do you believe clinicians, and it could be within or beyond athletic training, could better support our female athletes after concussion?
I think it's important to see the whole person, you know.
Hmm.
Clinicians should treat the student athlete, not just the injury. So recovery plans should account for the physical symptoms, like we've talked about, emotional well-being, academic demands. If a concussion happens in the middle of midterms, like whoa,
Yeah.
that's
Right.
pretty stressful anyway. Social stressors and when important or appropriate, the hormonal factors that we talked about. And
Hmm.
we need to make it a point to ask better questions, I think.
Hmm.
Conversations around sleep, menstrual cycle changes, mood, anxiety, stress, what their prior headache history is, and I think
Hmm.
probably in your work as well, we've seen that if there is, I think, either ADD or ADHD component and consistent migraines, that kind of
Hmm.
impacts recovery. So gathering that information should be part of comprehensive concussion care rather than afterthoughts. And
Right.
then communication, collaboration are critical. I mean, I'm really fortunate being at the University of Michigan. I'm in a place where our care team, student athlete health and welfare, is a team. And of course,
Hmm.
the athletic trainers, we have great office banter and camaraderie about whose student athlete roster finished this form first or XYZ. But I know that I'm a phone call or a 2-minute hallway walk away from a strength conditioning coach, a performance
Right.
dietitian, a mental health professional, a physician, another athletic trainer to inquire about. So collaboration is absolutely critical. And um, maintaining that collaboration with student athlete health and welfare and evidence-based practice in mind, and then sharing that education as a care team with the coaches
Hmm.
helps everybody get on board with a collaborative decision from the academics, athletic, and sports medicine side. And it
Hmm.
makes them feel more supported. So that's the biggest thing. We should validate the student athlete's experience. Concussion symptoms are often invisible, and it's not like I can't put a cast on it, I can't put a band-aid on it, I can't tape it up to go back in. It doesn't work that way. So just because they look fine doesn't mean that they feel fine. And creating
Hmm.
an environment where they feel heard and believed and can have a meaningful impact on their recovery for sure.
Yeah, certainly. I think it almost mirrors a lot of the mental health marketing that we've seen and being aware of and making sure that everyone's experiences, like you said, are valid and listened to. So I totally agree with that. Um,
Mhm.
I'm curious, just because you work with field hockey specifically, as you mentioned, primarily a female sport. When you are working with your strength and conditioning coaches, have there been conversations about potential cervical strengthening as almost a preventative measure? And if so, do you mind just detailing that a little bit further?
Absolutely, yes. I don't have the actual sets, reps, and volume assignment, but working with
All good.
Caitlin Smith, who is our strength and conditioning coach, she does an excellent job, and she'll even be proactive about it with me because we'll go over the injury report every week, and she'll say, "Okay, so next strengthening's okay for that one," and I say, "Yes, great," because I
Great.
don't think we're dealing with any nausea or sleep disturbances right now. So when it's okay
Hmm.
for them to go to the weight room or return to the weight room as a part of their return to play, that is, by protocol added in and then included throughout the rest of their lifting sessions, at least for that semester. And
Yeah.
then we usually do touch points as well to speak with the athletes about how they're doing and how it's impacting their continued care.
Awesome. That's wonderful. For those listening who are not familiar with that space, there is a multitude of research out there that is looking into cervical strengthening, whether that's the anterior neck musculature, lateral or posterior muscles, as a way to brace for impact so that the forces aren't going directly up through the skull. It's almost absorbed through the body. And there is a lot of emerging evidence to show that that would be very beneficial, particularly for our female athletes who have smaller neck circumference and smaller or less muscle strength than our male counterparts. Maybe my last question for you is, what is a key takeaway that you would like other clinicians to remember from the work that you are doing clinically, and how we can best support our female athletes after concussion?
Yeah, I think my biggest takeaway that I want everyone to take from this conversation is that concussion recovery is not one size fits all. I think as clinicians, we understand that because we see multiple throughout different student athletes, at least in the athletic training room. I'm working with field hockey, but I'm going to see student athletes from other sports as well. And I've explained it before when working with coaches or other non-clinical professionals to provide that education. It's really where the science meets the art. Like we
Hmm.
need to work with the evidence, but also apply it in a way that is well absorbed and understood by the student athlete, their parents, the coaching staff, and not necessarily generating buy-in into what they need to do, but understanding that it's one brain that they have for the rest of their life. So
Hmm.
that education is clearly paramount, and particularly female athletes are not simply smaller versions of male athletes. I've heard that
Hmm.
said before.
Yeah.
And the recovery experience, again, like we said, may be influenced by many different factors that deserve consideration. More individualized our approach becomes, the more it's individualized, the better outcomes we can achieve. So our
Hmm.
responsibility as clinician, I think, extends beyond returning an athlete to play. We're helping them return to learning, as you've said before, and provided us with great education on that. Relationships.
Hmm.
Confidence is huge. If you've ever
Yes,
worked with a tennis player who is recovering from a concussion and they have a ball flying at their nose, they stop dead in their tracks.
I
Same
believe
thing
it.
with a field hockey ball. A field hockey ball is a dense, oversized golf ball for anyone who doesn't know. If I'm not working with people to help with hip and low back pain because of the length of the stick, and knee issues, it is usually hand fractures from the ball or head
Oh,
trauma from either
yeah.
banging into other people
Hmm.
or the ball itself. Um, so just listen carefully, ask thoughtful
Yeah.
questions, and recognize the unique experiences of the female student athlete. We provide care that's both evidence-based and athlete-centered, and that's important.
Yeah, absolutely. Well, thank you so much, Claire, for your time. It's always a pleasure to chat with you,
Yeah, likewise.
especially learning more about your clinical experiences and really where your career has taken you. So you've been into all these different spaces clearly, and I'm just so excited to stay connected with you and learn more from you.
Wonderful. Thank you so
Thank you
much.
all. Of course. Thank you all for listening to the Concussions in Women podcast. Please make sure to like and subscribe to the Concussion Talk podcast to stay up to date on the latest discussions on concussion. Thanks, everyone.